Yeah, I'm in my residence room. I'm going to introduce myself. Hi, Diana. My name is Abina. I'm going to do your postpartum assessment today. So I've already introduced myself to my patient. I've told my patient what I'm going to do. So I'm just going to give my patients privacy, and I'm going to don my gloves as I do this. And I'm going to ask my patients if they would like to use the bathroom before we do this assessment. Diana, would you like to use the bathroom before we go ahead and do this assessment? You just use the bathroom. Okay, so the patient said they just use the bathroom. I already given my patient privacy. Anyway, it's a short video and it's about nursing assessment of a postpartum mom. Now, this assessment also has an acronym that says bubble hay. It can be done on a mom who delivered vaginally or a mom who had a cesarean section. Now, before I go into the assessment itself, I have to find out from my patient if they are going to breastfeed or bottle feed. So, if they bottle feeding, I have to give my patient teaching about what to do and what not to do because they're not breastfeeding. So, I need to teach my mom, the baby mom, that she needs to get good and firm and supportive bra because the bra is the breast is gonna get heavier. They're gonna get engorged. They're gonna get heavier. They're just gonna be the same way like a mom who is. They won't be like a mom who's breastfeeding because the milk will come out, but yes, the milk is gonna stay in. So the breasts are gonna be heavy. They're gonna be the breast is gonna be heavy. They are going to also be engorged and they would be painful. They're going to be painful. So I have to let the mom knows that her breast is going to get large, they're going to get full, they're going to be engorged, they're going to be tender. But if that happens, there are things the mom can do to the breast to get comfort. So mom needs to put cold ice pack on on the breast, or they can also put cabbage in the fridge and get the leaf like get them one at a time and put them in a bra and wear them to cool the breast. They if the pain gets severe that they cannot control it or they are very they having discomfort, they can take analgesics to bring down the pain. They also need to avoid stimulating the breast because they're not breastfeeding. So there's no need stimulating the breast to get more milk because then you're going to trigger your hormones to think that you sometimes when they feel the pain, they feel like when you squeeze the milk out, it will make you feel better. Actually, it's going to make you get more milk. It's going to trigger your hormones to think that you're breastfeeding and give you more milk. They don't need to run warm water on the breast because it's gonna vasodilate the milk that in the breast, and so they need to avoid using warm water on the breast. Instead, use cold water when you are in the shower. Now we'll move on to mom who is breastfeeding. Mom who is breastfeeding, if I need to go in there, mom is gonna breastfeed. So I need to ask mom a few questions. How is breastfeeding going? How is baby latching? How is baby latching? Uh, do you have any pain when baby latch? Okay. So if mom responds yes, then I need to check mom's breast and see why she's getting pains. I need to check the nipples. I'm looking for cracks. I'm also looking for redness. I'm looking for swelling. I'm looking for blisters. So if that is the reason, then I need to then it would let me I would know that the baby is not getting enough milk because of that pain. Mom is not able to let the baby get enough milk because she's in pain. So I need to teach mom about breast, well, how the breast is going to engorge because on the third day, by the third day, the breasts are going to get full, they're going to get heavy, they're going to get large. So, mom also needs to get firm, very nice and firm supportive bra. She can also run warm water on her breast to dilate the milk ducts so that she can get more milk for baby. So we move from when mom is breastfeeding, she needs to rotate to avoid breastfeeding only with only one breast. Uh, and leaving the other, which is going to get hardened and get mastitis. And then when there are cracks and blisters and stuff on the nipples too, when that they can have a infection, bacteria from baby mouth and get infection, and that can also lead into mastitis. We're going to move on to okay, so breast, and then we go to which is uterus. We're going by the bubble here. So U is the uterus. When before mom gets pregnant, the fundus is within the pelvic cavity. So when as soon as mom gets pregnant, the fundus moves up and come up, it goes beyond the umbilicus. And then when mommy gives birth, after postpartum, the fundal starts moving. So it moves up into the beyond the umbilical. So it's up. But every day it will move 1 inch. After mom gives birth, every day it's supposed to move 1 inch, 1 centimeter. Sorry. You can feel it when you can use your either your three fingers to massage it. It feels like a grapefruit, or you can use just one finger to measure for 1 centimeter. Every day it will move. For 6 weeks, it will move back to its normal location, the pelvic cavity area. If it moves 1 centimeter and it goes beyond it goes below the umbilicus, then it's it's positive, which means that it's a good thing. It's moving to its own. But some of the things, there are things that can prevent it from moving, and it has to be in the midline too when it's moving. Uh, there are things that can prevent it from moving. One of them is full bladder. That is why I asked mom if she want to use the bathroom before we start, because that can hold the fundus back. The only thing. So we need to, and there are things that will prevent mom from um, voiding. That would um, that will prevent the fundus from moving. But because of certain things, mom can have a pain in the peri area, or mom probably had a tear or stitches done, and all of this. There's an inflammation or hemorrhoids, or all of these things can prevent mom from peeing, because when you pee, there's salt in the urine, sodium in the urine, so it stinks. And if you have a cut down there, you don't want to pee to get it stink. So mom would rather avoid pain. But I need to encourage mom to know that peeing is better for her. If she can't pee on her own, then we have to give her a straight catheter to pee through it. Because if she doesn't pee, the fundus will not move down, and that can create postpartum hemorrhaging. Now the other thing is, when so we know that when bladder is full, it creates fundus, and then it can create hemorrhaging. So we'll move from bladder, and then we go to bowels. The same thing can happen from bowels. Mom can probably be having hemorrhoids, which is painful, maybe swelling, stitches, or a tear, or anything can happen down there that will prevent mom from wanting to go and push and have BM. But that we have to encourage mom to not to hold the stool, because she will not getting constipated. So there are things that we can teach mom to do. Mom can drink a lot. Mom can walk around. Mom can eat a lot of fruits. Mom can eat high fiber foods to soften her stool so that she doesn't have to push for that pain. I will move on to leg 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 here. Leg here is the lining of the uterine. It's also can be blood from the placenta. If mom is laying down after postpartum, like she's already given birth and she's laying down, she lies down, there can be a pool of blood. So when mom gets up from blood in bed, there can be like a gush of blood, which is normal. But if mom is lying in the bed and you come around and there's a pool of blood while she's lying down, that is not normal. be like there's probably a leftover placenta that was now cut off, and so she's is making her bleed. There are three stages of leukemia. There's rub, there's rubra, and there's serosa, and there's alba. Now, the rubia is red blood. So you move from that stage, and then you go to serosa stage, which is pink. So if you get to pink, and then you go back to rubra, that then there's a problem. Maybe there's a placenta piece or placenta cut that was not cut off, and so you start to bleed again. So that you need to seek emergency help. Um, and or you can go to Alba and go then those then it means that there's a problem. So they need to be taken care of. Um, you need to seek the hospital attention immediately. And then we'll go to epi if if it's your tummy. If it's your tummy, if it's your tummy. It's when okay. So that is usually done. It's a like a suturing incision. Okay, done. Okay, so when that's normally done when the baby is too big to be born, so they would cut part of the vaginal between the vaginal and the anus. They cut part of it just to create a bigger space for the baby to be able to. Or when there's a quick or the baby being delivered hurriedly, they would do that opening just to get a bigger space for the baby to be able to come out. Or if they're using some kind of instruments that is to to get into the vaginal area, they would make that incision to be so you need to assess that we need to inspect that incision. When you're doing that, you have to roll mom over so you can see in between and look for redness, swelling, everything, incision, approximated, ecchymosis, everything that is led to incision. The same thing if mom had a cesarean section, you look at all those things and you will assess for that. And so that is one of the things. So if mom had that and it's pain, we can give mom ice to put mom going to pee. She will need a pee bottle where she can put some cold water in there to cool her down to pee. Now we'll move on to um there's heat bubble heat. Okay, so we'll be looking for uh the extremities, the legs. If mom is lying down and not moving around, we need to assess the legs. We need to make sure there's no, and that one is called that one is called Homer's signs. It's easy to do. That's the easiest way. There are other ways you can do. You can check the legs and stuff like that. But you can also ask which is the most of the time this it works. You can ask mom to dorsiflex, which is called the hormone signs. She dorsiflex, and if there's a clot, she would feel the pain quick as anything, so you can pick up on that. So that is the one. Then we go to emotions, which is we have baby blues. We also have postpartum depression. So baby blues is okay. Mommy will be crying on this, like not knowing what happened or what the problem is, and cry uncontrollably. That is normal. It will be okay. So we're doing all this education when there's a family member. Mommy probably doesn't have, like she can't wrap her head around all this information. So that family member will listen to all this, and then because it's family oriented, maybe they will be the baby father, they will be mom's mom, somebody will be around and who get hold of all this information. And then when mom is not able to remember all this, they will say, "Oh, I heard the nurse say this, the doctor said that." So it's normal. But when mom loses interest in herself, don't want to do anything, then it becomes a problem. I think I'll bring this to the end of my teachings to mom, and I'll give mom a good pericare already, and I'll also give make sure all her incisions has once everything is intact, and then I'll give her a good pericare, give her her pad, make sure her environment is tidy, and give her the call bell. If you need me, mom, you can call me, and I'll be right here. Thank you.